Thank you. Gentleman from Texas recognized for 5 minutes.
Thank you very much, Mr. Chairman. As has been explained, this bill is a package of 6 separate bills. All of them seem worthy, most modest in their scope. One simply codifies, puts into law what is already agency practice. Another extends by a few years a demonstration project which appears to be working and on which we need further insight. I have no problem with any of the 6 separate measures that deal with different parts of Part B. I do find it ironic, in no way disparaging the efforts of all those that have commented, that this bill is being taken up on the day that we see the next sequel in the trilogy of health care measures, this one over in the Senate, which will, of course, do far more harm to far more people than anything we're able to do here today through this piece of legislation. I do think that there is one glaring omission. As proposed, this bill, while it deals with Part B, does not address any aspect of the ever-rising cost of Part B medications. Since last September, I've sought hearings across the board on soaring prescription prices in this committee. I think that they threaten families and they burden most any type of taxpayer-financed health care initiative. And I've raised this troubling issue at a number of our related hearings and markups going back well into the beginning of last year, joined on several occasions by a number of our Democratic colleagues who are concerned about the exploitation of government-approved monopolies that can and do result in monopoly prices. There have been few opportunities that have been permitted within this committee to address this challenge, and none of these permit the offering of comprehensive solutions. But today, we can take a very modest step to just ensure that we have the prices that are being charged for Part B pharmaceuticals. Under long-standing existing law, pharmaceutical companies are required to provide average sales price data on Part B Medicare drugs. In July, 3 years ago, the Office of Inspector General at the Department of Health and Human Services found that at least 1/3 of the more than 200 manufacturers of Part B drugs had not submitted the average sales price data for some of their products, and an additional 45 manufacturers had not been required to report any data. The Inspector General found that inaccuracies in these average sales price files may affect Medicare payments. Last month, and we've heard that there was a hearing by the subcommittee last month on this issue, on the MedPAC report. MedPAC reported to Congress on Medicare and noted that this problem about average sales price data continues and that it's not been addressed by this Congress as the Inspector General had recommended. My amendment simply implements the recommendation of MedPAC and the Inspector General to raise the penalty for failing to report the average sales price data that is required by law and ensures that all Part B manufacturers report that data. It simply ensures compliance with longstanding law to protect program integrity and taxpayer interests. Though denied any opportunity really to address price shocks, we ought to at least assure that the data, the information, is available so that responsible authorities always know how big that price shock really is. And with that, Mr. Chairman, I would move adoption of the amendment.
Thank you, Mr. Nunes. You're recognized.
Mr. Chairman, I make a point of order to the amendment because it is not germane to the amendment in the nature of substitute. The amendment violates House Rule 16, Clause 7, because the amendment makes changes to Medicaid, which is outside of the subject matter and beyond the scope of this bill, which only touches Medicare Part B.
Thank you. Does the gentleman offering the amendment wish to speak on the point of order?
I do, Mr. Chairman. I certainly respect your legislative craftsmanship in the way you draw the legislation, in some cases in a very narrow way, to preclude amendments. Certainly that was true in our recent consideration of TANF legislation. In this case, this is Medicare Part B Improvement Act. We have seen what a wide range of legislative aspects of Medicare Part B that this is. It's unfortunate that it was not included from the subcommittee to deal with this very pressing problem. It does not address the soaring prices within Medicare Part B. It only addresses securing data required by current law. It concerns only Medicare Part B. And I believe that it's important that we take this one modest step clearly within the scope of the title of this bill, and I would urge that the point of order not be sustained.
Thank you, Mr. Doggett. I am prepared to rule the amendment is not germane to the amendment in nature of substitute because it violates House Rule 16, Clause 7, amending Section 1927 of the Social Security Act, which deals with Medicaid, which is beyond the scope of the bill. Point of order, sustained. The amendment is not in order.
And on that, I would respectfully appeal the ruling of
The
the chair.
ruling of the chair is appealed. Mr. Nunes moves the table to
I move
appeal.
the table.
Questions on the motion to table the appeal of the chair's ruling? All those in favor signify by saying aye. Those opposed, no.
No.
Opinion of the chair, the ayes have it. The motion table is agreed to.
Mr. Chairman, on that, I would request a recorded
Roll
vote.
call is requested. The clerk will call the roll.